I'm looking forward to giving you an overview of our ND program here at NUNM. And I also want to make sure that there's time to answer as many questions as I possibly can. I was able to embed some commonly asked questions throughout my presentation today, so hopefully that will address some of the questions that you might already have. Um, you can use the chat. That's probably going to be the best way during my presentation to get a question to me. Nicole or Dr. Petcho, I might also need some support in answering questions as they come up because I don't think I will be able to see them. So I'm going to go ahead and share my screen. Great. Okay. So before we get started, I want to just give a little bit of information about myself and how I came to be the dean here at NUNM. I'm originally from Chicago. I graduated from Bastyr University in 2005 with my ND degree, and then graduated from NUHS in Lombard, Illinois with my chiropractic degree in 2006. I also have a master's degree from NUHS. After I graduated, I went into private practice for a short brief of time before I was recruited back to NUHS to teach. And I was an instructor and a chief clinician there for 6 years. Helped to start their clinical program at that institution. And then in 2013, I left and joined Cancer Treatment Centers of America, where I was a naturopathic oncology provider for 4 years. I'll probably tell you a little bit more about my journey as we go through this presentation today. And then in 2017, decided to relocate out here to the Pacific Northwest with my family. I started at NUNM as an instructor, and then in January of 2020, became the interim associate dean of clinical education. And then shortly thereafter, in July until current, I've been the dean here of the naturopathic program. My teaching experience is pretty vast regarding the topics that I have taught on. You can see some of them listed down there. Where I historically have taught here in the ND program is in the physical medicine realm, although my passion is in oncology and supporting patients as they go through their various standards of care treatment with the diagnoses of cancer. Personally, about me, I'm a mother of a very spunky 10-year-old and love all the things that the Pacific Northwest has to offer, from hiking to cycling. I used to be a marathon runner, love gardening, all the things that we have really easy, quick access to here in the Pacific Northwest. I wanted to start a little bit just showing you NUNM's mission and values, our mission statement, and then I'm going to show you specifically our ND program mission statement. And I just want you to read this and I want to see if it resonates with you. When I was searching for what my professional career was going to be, it was the mission statement of the institution that actually sold me on the program and the type of doctor that I wanted to be. So go ahead and just read these and hopefully it will resonate with you. Okay, so what is naturopathic medicine? I'm going to give you just a brief overview of what naturopathic medicine is before I start talking more specifically about our curriculum here at NUNM, because Dr. Petcho is going to give you so much more information after my presentation on the philosophy of naturopathic medicine, our therapeutic order, and all the things. And so this is, I'm going to try to do a 10,000 foot view here. So naturopathic physicians can be qualified as primary care physicians, depending on the state that you'll be practicing in. We are also very well known for being a complementary care to patients who already have a primary care physician established. We take a holistic approach to treating patients. So looking at their mind, body, and spirit, and how those things all intersect and how they all how they can all interface and affect one's health and well-being. One thing that I love about our medicine is that we are really taught, and you'll be taught here at NUNM, on how to identify and treat the cause of disease, and not just providing a treatment that puts a band-aid over something or masks a symptom. Now, you will learn probably from Dr. Petro's presentation that at moments we do have to do that because of the safety of the patient. There is a time and a place for those more higher interventive treatments and those referrals to specialists and surgeries and all the things. But we know when to implement it, and we look at it from a holistic approach. We focus on identifying and removing barriers to good health. So what is that underlying cause of one's symptoms? And is there something that we can do to address that to then remove the symptoms that follow? In our medicine, and as Dr. Petra will let you know, is that we utilize so many tools. We are trained with so many tools in our toolbox, and those include modern medicines, pharmaceuticals, minor surgery procedures, IV treatments. But we also teach you from more of the traditional routes, the things like hydrotherapy and homeopathy and botanical medicine. And so when you leave your education here at NUNM, your tool bag is going to be so robust. And then I also can't miss telling you that when we teach to you, we are going to be teaching you for those evidence-informed methods. So what does research show to be most effective, both from that pharmaceutical perspective, but also from these natural treatments? So here, very briefly, are the principles of naturopathic medicine. Dr. Petra is going to go into it much further. I will share with you that the things that really resonated with me as I was looking into this profession nearly over 25 years ago at this point was doctor as teacher. So it does not surprise myself and probably those of you that are here with me that I have found my way back into academia. And once again, I also resonated really well with identifying, treating the cause of disease and the healing power of nature. The therapeutic order. So as you go through your education here and also when you are out in practice, we teach you based on this pyramid of how do we meet a patient where they're at? What does their body need? What is their condition, diagnosis, disease need in order to not cause any harm and to support them? And as you can see at the way top is surgery. And yes, there are times when surgery is indicated, and there's times where, as an ND, you might be performing a minor surgical procedure, not a major surgical procedure, but a minor one, and that's part of your scope of practice in some states. But the thing that I love most about our medicine is that bottom, that establish the foundations for health. So one thing that we are looking at in all of our patients is how can we reestablish those foundations that create health in someone? Things like sleep, exercise, nutrition, stress management, sunlight, etc. So, regardless of the disease state and where a patient is in this therapeutic order or disorder, we always want to look at how can we establish these basic needs for one's health. Okay, for the prereq courses required for admissions, if you are missing any credits at this point, is it possible to fulfill these at a community college before applying? Yes, absolutely. I would encourage you to reach out to one of our admissions counselors for further information. If you have any questions about what any remaining prereqs that you might have, how they can be met. So what does our program look like here at NUNM? It is a four-year program. Some students will start on the four-year program. Some students will start on a five-year program. Typically, and most of my presentation is gonna talk based on this four-year program. So the first year of the program is focused on your biomedical science courses. Those are things like anatomy, physiology, biochemistry, all the basic biomedical science courses. That first year is robust. I was just talking with a prospective student the other day, and I said to them, it's like a fire hydrant coming at you of information. And as much as I tell you that now, I still hear from our first year students, wow, you told me that it was going to be a fire hydrant of information, and I really truly didn't understand what it was going to be like until I was in the thick of it. So it is rigorous. It is the same as going through a medical program with those biomedical science courses. The first year, what we also like to do is to give you an introduction to the philosophy. So you'll get a little overview with Dr. Petro, but then you'll delve in deeper to the first year, the philosophy and principles of naturopathic medicine. You're also going to be introduced to the major modalities, the nutrition, pharmacology, hydrotherapy, etc. So you get a little bit of orientation to those classes in your first year. In your second and third year is really when you're going to delve more into your clinical science courses. So these are like your ology courses. So gynecology, gastroenterology, etc. Um, I'm going to talk about clinic here in a minute. And then your fourth year is really focused on your clinical internship. So as a student here in our curriculum, one thing that I cannot stress enough about what I like about how our curricular design is students that are in a 4-year track in their first year for our on-ground program will start in our clinic as early as winter of their first year doing a hydrotherapy shift. So you will be starting seeing patients or in a tech role, but you'll be taking their history, doing some basic physical exams, and providing them a hydrotherapy treatment as early as winter of your first year. In your second year, you'll be doing more clinic observation experiences. In your third year, you'll be required to do 3 rotations. One is on what we call physical medicine shift, one on a nutrition shift, and one on a general medicine shift. And then in your fourth year, you'll be completing 13 what we call primary rotations, where you'll be seeing patients overseen by a licensed physician in that last year. So you can see how the gradual responsibility of clinical requirements increases as you go throughout the program. This is just going to overview exactly what I said regarding the first year, primarily focus on those biomedical science classes. Second and third year is going to be more organ specific classes. I will talk a little bit about, you'll see in there it says lab and tutorial courses. So we have different makeup of different types of courses, primarily at NUNM. We have lecture courses, we have tutorial courses, and we have lab courses. So your lecture course is going to be what you think of with a lecture course. Most of it will be in person if you're in our on-ground in-person cohort. Some of those lectures might be pre-recorded in an online asynchronous manner, but majority of it will be in person. We have lab courses, which is your typical lab course where you'll be coming and learning some type of practical skill, whether that's your physical exams, whether that's performing a blood draw, whether that is performing how to set up an IV, or perform things like physical medicine, spinal manipulations. And then your tutorial courses are small cohort, oftentimes a maximum of about 14 students, small case-based discussion courses. So you'll be taking the content that you're learning in a lab course and the corresponding lecture course, and in those tutorial courses, you'll be putting it together. You'll be talking about a case, you'll be figuring out what the diagnosis is, you'll be figuring out what the appropriate treatment is, all in these small discussion-based settings. And then, as I mentioned, in your fourth year, in addition to primarily looking at being in clinic and treating patients, you also will have other classes that just help you kind of put it all together in that last year. There'll be a course that makes you dig a little bit deeper into maybe some outcomes in a clinical setting that weren't optimal, and what were things that maybe got in the way of an optimal outcome. And then you'll have in your last 2 years really a total of 3 business courses. So what are the average class sizes at NUNM? You know, this really depends on the type of course. So your lecture-based courses are going to have all the students that are in your cohort. So however large your incoming cohort would be, that's how large your lecture based courses would be. Tutorial courses, as I mentioned, and also lab courses are smaller because it's more hands-on, practical, small group discussions. So those oftentimes are a maximum of 14 students per section. What's the professor to student ratio? Once again, this really depends on the type of class. So in the lecture, 1 to however many are in your cohort, and then tutorial, it's often that 1 to 14 ratio. I do want to just comment on NUNM's, the faculty that we have here. We currently have 15 full-time faculty members and about 32 adjunct faculty members, and then numerous guest lectures that I couldn't really count up here. NUNM has some long-standing faculty members that have been teaching since the 1980s. Their depth of knowledge about the profession and the courses that they teach and the knowledge that they share is just so valuable. And we have so many that have been here for quite some time. It is such a valuable resource that I think goes um, overlooked sometimes, which I can't sell it enough because it really is one thing that is so special about our institution is the depth of knowledge and commitment that our faculty have to our program. Are the students working closely together often, and does that lead to close bonds between students or between student and professors? Yes, with a smiley face on it. Um, I was not a student at NUNM, but I can share that going through my ND education, it is it is such a rigorous program that by default and because of the I guess in relation to some other programs, it's a smaller program. You are going to get to know your colleagues very closely and inherently will create such close bonds. So some of my closest friends today are those that I met in ND school. If attending the first year in person, what are class times and structures? So I also wanted to point out that we're the only institution that has an accredited first year online program. So you can choose to do your first year online or in person. So if you choose to do it in person, what are the class times and structures? So we don't actually have that schedule yet. We won't have the fall schedule until about halfway through our summer term. But what to expect is a typical day of about 8 to 5. It's a full-time job, 5 days a week. And then of note, for every hour spent in class, it is expected that you spend 2 to 3 hours outside of class studying. So keep that in mind as you're thinking about options and what it's going to look like for you, and maybe what program is better on ground and or online. So what is the structure of our online program? So our online program has about 4 to 6 hours per week that are required online synchronous, meaning mandatory you have to be present for those teaching opportunities with your instructors at that time. As you can see, it has a lot more flexibility. And when I say flexibility, meaning that you're still going to have deadlines, you're still going to have content you have to go through, still going to have exams on certain days or certain weeks. So you have to be able to structure your time appropriately to be able to get through the material and not get behind. So I just put in here some traits that I thought of a successful online student. And I apologize with the funky kind of organization of this slide. So, able to manage your time appropriately, adaptable, effective communicator, self motivated and disciplined, accessibility to internet and internet speed, organized, computer literate or ease with technology, and excellent planning ability. When I think of our online students that have been successful, these are things that have come up for me repeatedly. Um, there are many benefits to an on-ground program. There's many benefits to an online program. And I know some students are like, well, what's better for me? And each student is going to have to decide which is better for them. If you want to have something to help you decide, there are some online resources. And honestly, I don't know if I should have shared these because they're from various institutions, but I shared them anyways. But if you Google online learning readiness questionnaire, I think a ton will come up. And oftentimes they're really short questionnaires, but they're going to ask you questions to help you make that decision on if an online program is really going to set you up for success. Even if you have decided one way or the other that, yes, I want to do your online program, I would really encourage you to take this to see if this questionnaire supports your learning styles. I think it's something really important to know before you start an online program, especially a first year medical school online. Is emergency medicine taught in the curriculum? Yes, it is. We do have a standalone emergency medicine course that will be taught towards the end of the curriculum. Additionally, you're going to learn how to manage urgent conditions throughout the curriculum. For instance, Dr. Petcho teaches our cardiology students, and they just a week or two ago went through some mock sim patient cases. I think heart attack was one of them. They're just urgent cardiopulmonary conditions that they learn to triage urgently. So while there is a standalone class, you are going to be learning how to manage these things throughout the curriculum. You're also going to be required to be CPR certified to be in our clinic. Um, just for clarity, and I guess we'll probably get to this a little bit when we talk about scope of practice and stuff. Emergency medicine, it has to fall within obviously our training and our scope of practice of what we can do in an emergent situation. Oftentimes, we are stabilizing a patient and sending them off to the emergency room. What skills outside of naturopathic medicine are taught in the curriculum? There's really too many for me to list, but some that I wanted to highlight that you might not see as you're looking through our course catalog. You will see the 3 business courses listed in there, but physician cultivation isn't something that you're going to see. Motivational interviewing is not something you're going to see in the course catalog because these things are embedded in the curriculum. Same thing as ethics. So just a few other things I wanted to highlight that you will have training in. Part of your requirements is that you'll be required to complete 15 credits of electives. We have various elective courses. You can see some of them listed in here, just kind of basic topics of what you can choose from. This is really a great way for you to see, gosh, I think I like homeopathy. Let me take an elective course and see if I really like it. So great way to explore, great way to maybe, if you already know something that you're interested in, to explore it even further. What are some organizations in the program that students can get involved in? Um, there are so many clubs on campus and organizations. Some of the 2 organizations that come to mind is SGA, or our student government organization, and also NMSA. Dr. Petcho, I'm going to botch this. What does NMSA stand for? Naturopathic Medicine. And
Medical Student Association.
thank you.
Yeah.
Correct. And each school has its own chapter, which is great. So our Office of Student Life can provide you, and I think they do provide you with an overview of all the different clubs and organizations that you have access to during your new student orientation. So clinical training, I can't stress it enough how I'm just going to say wonderful because I do think it's wonderful. I'm going to brag about our own clinical training. Our clinical program is at NUNM, and I do think that it sets us apart from some other clinical programs out there. By the time you graduate, you'll have 1,254 hours of direct clinical training. As I mentioned before, it's going to be throughout your 4 years. That is something that differs us from other institutions, is that we do get you in clinic as soon as possible. We recognize that you are here, or most of you are here, to be clinicians. And so instead of separating out biomedical sciences from clinical sciences and clinical training, we kind of mush it all together with the goal of allowing you to have access to and experience with patient care as soon as you start here and through those 4 years, so you have a robust clinical experience. We do have our one main clinic, which you can see in the picture to the left. It's that kind of creamish colored building, which is now gray if you're here in person, but in the picture it's cream. We are a tier 3 primary care home, which means that we are assigned to be primary care providers for folks that live in the area. And we do accept Medicaid, which because of that, I shouldn't say because of that, our clientele is so diverse. What our students are uh, exposed to in our clinical training. Having worked in multiple clinical settings, I can say that with 100% truth that I saw more pathology in our clinic here than I have in any other clinical experience outside of Cancer Treatment Centers of America in our clinic, meaning that students are seeing patients with uncontrolled hypertension. They're seeing patients with uncontrolled diabetes. So oftentimes we are intervening at a higher therapeutic level of pharmaceuticals to stabilize their condition while we're also working on those basis of health. What does their nutrition look like? What does their movement look like? What does their sleep look like, etc. So students in our clinical program do have a pretty robust clinical experience and exposure to many diverse patient populations. We also currently have 3 community clinics. One, you can see them listed up here. We used to have many, so if you've seen some of our past information on community clinics, we did have a lot more. Unfortunately, due to COVID, a lot of those sites closed. A lot of those sites did not allow us in, and so we're still, since COVID, trying to explore our relationships again with more community clinics throughout the Portland area. Okay. In the 4-year program, can the first year be completed online and the subsequent 3 years part-time? Unfortunately, no. The ND program does not offer a part-time option. As I mentioned, we do offer a 5-year program, which does reduce the credit load a little bit. I don't want to say significantly, but it does lighten the loads, particularly within that first to third years of the program. What is the maximum duration allowed to complete the program? The maximum duration is 7 years. That's primarily driven by financial aid. After 7 years, you will not qualify for financial aid. I do want to put in there that because there's no part-time option, the students that typically meet that 7-year max are ones that are our dual students. Some of our dual programs take 5 or 6 years. And then on top of that, if a student decides to take a leave of absence, you can take a leave of absence for up to a year. So when that all adds up, that's where some students reach that 7-year maximum. It's not because they're allowed to do a part-time program. Do students sign up for their own classes each semester, or are you automatically enrolled? You will be automatically enrolled in your core courses. That's so important. We have students that go in and remove themselves, and sometimes it's not caught until it's too late. So you will be automatically enrolled in your core courses. Is graduating with a doctorate in naturopathic medicine in the US entitle one to the medical title of a doctor and prescribing rights in certain states? So, great question. And I feel like there's a lot of nuances to this. So, from upon graduating from an ND program, you will earn a Doctor of Naturopathic Medicine degree. This is a distinct degree separate from a medical doctor. Therefore, you cannot designate yourself as an MD or a medical doctor. You're not a medical doctor. You're not going to be a doctor of osteopathy, which would be a DO. You are an ND. The Practice Act that's established in each state will determine your scope of practice, including prescriptive rights and how you can designate yourself. For instance, some states only allow MDs and DOs to use the term physician. So that is something, depending on what state you want to practice in, will determine what you can call yourself, if you can call yourself a physician or not, and then what that prescriptive right might be in that state. Okay. So I love this slide just because it does show you all the tools that you will have upon graduating, all the things that you will be trained in to utilize on your patients. What I also love about our medicine is that if you have a patient and say Dr. Petcho and I were seeing that same patient, that patient's treatment plan would probably look similar but different based on how we're going to approach that patient. I might recommend a botanical formulation, and Dr. Petcho might say, no, I want to do homeopathy and some lifestyle counseling for this patient. So that, and not one is right and not one is wrong. They're different approaches to treating the patient. And so that is also the art of our medicine. I wanted to put this up there. While most, and I think I get to this in the next slide, while most of our students go to naturopathic school to become a clinician or a primary care physician, there are so many other opportunities that you can explore with an ND degree. Things like academia, things like public policy work, healthcare administration, working for a supplement company, etc. There are so many different avenues that you can explore with an ND degree. This is what it looks like a little bit broken down by the number. So you can see majority, 75% will go into private practice. Others will go into other healthcare locations. Some will go into research. And then once again, educators are on there too. Those are the most common ones. Residency is not required after you graduate from ND school. Is it highly encouraged? Yes, I would say it is, but it's not required. So after you complete our 4-year program, you can obtain a license and start practicing. you can see based on here, about 15% of graduates complete a 1-year residency. And we currently have 8 NUNM residents on site, and then many that are at distant sites. So what is required for you to get an ND license? First and foremost, you have to graduate from an accredited naturopathic medical school. I do want to point this out because there are programs out there, some that are totally online that aren't accredited. So if you want an ND license, I would encourage you to explore the school's status when you're looking at where you're applying to. Are they an accredited naturopathic medical school? If you go to one that is not accredited, you will not be allowed to get a license. And that is so important because it's time and it's money. So please do your due diligence when you're looking at where you might apply to. Um, NUNM is accredited through CNME, which is our naturopathic specific accrediting agency, and then also NWCCU, which is our regional I can't even say that word now, accrediting agency. We just went through our visit with NWCCU and got reaccreditation there, and CNME was here about, I'm going to screw this up, 2 years ago for their site visit. And at that time, we got our reaccreditation for 7 years. So make sure that you are looking into accredited naturopathic medical schools if you want an ND license. And we have 2 board exams. We have NPLEX 1, which you take after your 2nd year at NUNM on a 4-year track. Your NPLEX 1 is your biomedical sciences. And then you have part 2, which you take after graduation. Those are more your clinical sciences. Once you get licensed, I don't know why this is on this, is kind of misplaced here, but in Oregon, we have to complete 32 hours of continuing education every year. So once you are licensed, and to maintain that license, you do need to do continuing education. So regulation, once again, you must pass an accredited program. You must pass your licensing exam, so your NPLEX exams, NPLEX 1 and 2. Many states will require you to pass a state jurisprudence exam and also a formulary exam. This is what you have to do in Oregon. You have to submit for fingerprints and pass a criminal background check. And that's what you need to do for licensure in states where licenses are obtainable, where you can get one. I do want to point out at the bottom, this is specifically in Oregon. Part of our scope of practice is that we can prescribe some controlled substances. And so if you're going to practice in Oregon, you do need a DEA registration to be able to have access to and prescribe those controlled substances. So I wanted to point this out to everyone. Currently, it's on the next slide, and I'm going to get the number wrong, but I think 23 states and provinces that offer ND licenses. So the states that are highlighted in green are states in which you can obtain an ND license. The other ones, the other states and the other colors are just indicating that states are either actively trying to get licensure, and you can see kind of the degree of how active they are in those other states. 23 states, 5 Canadian provinces, District of Columbia, and then US territories of Puerto Rico and Virgin Islands are where you can currently obtain a license. Which states offer full prescribing rights to naturopathic doctors? So I just want to say no US state offers full prescribing rights to naturopathic doctors. However, Oregon has the broadest scope of practice and prescriptive rights, including some controlled substances. Other states that have broad prescribing rights are Arizona and Washington. I actually think Vermont might be one, and I didn't put it on here, but those are the broadest scopes of practice in the states. I think I might skip over this. No, I'm gonna touch a little bit on this. So what is the scope of practice here in Oregon, and why this is important and why I put this in here is because at NUNM you are going to be taught to the broadest scope of practice within the state. Because in our clinic setting, when you're treating patients, these are all the things that you could potentially do with a patient that walks through our clinic doors. So provide services generally described as primary care. We also need to know when to refer patients, whether it's for urgent or emergent presentations. We're going to diagnose and treat our patients. We're going to refer and consult with other specialists. We are going to prescribe pharmaceuticals and controlled substances, those that we can, as they are indicated. We are going to prescribe and administer vaccines, ordering labs, images. We're going to do what we call more of those naturopathic therapeutics, counseling, lifestyle modification, nutrition, botanical medicine, homeopathy, physical medicine, IVs, etc. You're able to do minor surgical procedures. You can do IUD or Nexplanon placements and referrals. Um, and then I do just want to point out on the right-hand side, natural childbirth can be part of your scope. Oops, oh shoot, I went too far, one in advance. But you do need more training in that and more continuing education. So just from graduating from NUNM, you will not be able to do midwifery practices or natural childbirth. You will need to do additional training. This was already back in 2018, but our scope of practice did change, and it provided us with the ability in over 100 statutes that we were updated to include NDs as able to do these things along with MDs or DOs. So our scope continues to, even in the past handful of years, broaden here in Oregon. With that, we also comes duties. So as an ND in a licensed state, we are mandatory reporters. So the things that we have to report are things like communicable diseases, elder abuse, child abuse. What's outside our scope? It's a pretty broad scope. So what can't we do? We cannot do direct hospital admissions. We cannot perform abortions. We cannot prescribe the medications associated with Death with Dignity Act, and we can't do major surgery or general anesthesia. So as I mentioned, NDs are currently licensed in 23 states, 3 territories, and 5 Canadian provinces. The scope is going to vary greatly between those. In some states, you can't prescribe any pharmaceuticals. In some states, as Oregon, you have a pretty broad scope of practice. So based on where you want to practice, you really have to look at the laws there to understand what you're allowed to do per the law of that state. In unlicensed states, which you saw, there's still quite a few that are unlicensed or what we like to call pre-licensed states. Practitioners can't diagnose or prescribe treatments and typically end up functioning more as a natural medicine consultant in that state. Others end up working in integrative clinics where they see patients under the supervision of another licensed provider. If you earn this degree in the United States, would you be able to practice in another country? This is another great question. The ND degree is offered in other countries. However, in those other countries, they're oftentimes offered at a bachelor's level, not at a doctorate level. So if you get your ND degree here in North America and want to travel to another country to practice, I would encourage you to investigate how and if that ND degree is recognized in another country, and then follow their licensing laws and practice the laws that are specific to that country. Typically, from my understanding, the ND degree can translate to other countries, but you're oftentimes not practicing in a primary care role. You're oftentimes practicing more as that. I mean, they still would call you a naturopathic provider, but you're doing more of the natural therapies, the nutritional counseling, the botanical medicine formulations and stuff like that. You're not the primary care provider. I will end with this, and then I think we will have some time for some questions. So What makes NUNM unique? Once again, I can't stress enough the strength of our clinical education here. Being a state credentialed primary care home provides students with so much access to patients and a diverse patient population. I did talk about our distinguished and long-serving faculty, the community. You ask any student that is here, a faculty member, why they're here, what keeps them there, and they continually talk about the community that we have here at NUNM. We do offer concurrent degree track. So as you're getting your ND degree, you can also get other degrees like an acupuncture degree or a master's in nutrition degree. So we do offer that to students. And then Portland, I mean, I'm the wrong person to ask. We moved back here because we wanted to live in the Pacific Northwest, but it's just such easy access to the mountains and waterfalls and hiking and the ocean. So even though you're going to be extremely busy within your time here in your medical education. The beauty is that the mountains are an hour and a half away. The coast is an hour and a half away, and you can take a day trip to either location and be completely in nature for your own self-care. So that is what I love about Portland and UNM.